Match the two parts of the sentences. Look A, B, C opposite to help you. The first one, 1988 saw the UK launch of leaf attenuate with attenuate, the letter J, measles, mumps, and rubella vaccine. Chickenpox, varicella is common infectious disease of childhood. Rabies has an incubation period ranging from 4 days to many months. The patient remained febrile, which peaks of temperature of 39.5 Celsius. He was admitted with a 4-day history of influenza type symptoms of fever with rigors, myalgia, and general malaise. Quite a proportion of patients who recover from hepatitis B become carrier of the virus. The central part of Africa is in the midst of an epidemic of AIDS. The central measles rubella is most infectious during the catarrhal stage. Lyme disease caused by transmission of the Burgdorferi from animals to men by oxid with ticks. PUO stands for pyrexia of unknown origin. Combinar las palabras con las oraciones. En 1988 se vio en tratamiento en vivo atenuado de la vacuna, del sarampión, rubeola y la papera. La varicela es una enfermedad infecciosa, una infección común de las enfermedades de la niñez. Los conejos tienen una incubación que sería el periodo a muchos meses de incubación. El paciente se mantiene febril, con picos de temperatura de 39.5 Celsius. Él fue admitido con 4 días de historial de influencia, con síntomas de tipo influencia y fiebre con rigores, mialgia y malestar general. Una pequeña proporción de pacientes que se mejoran, se mejoran de la hepatitis B, son portadores del virus. La parte central de África es en el epidemia de SIDA. La rubeola es más infecciosa durante la etapa catarral. PUO significa pirexia de un origen desconocido. Complete the case report on the patient in A opposite. Look at ABC opposite to help you. Case 45. On examination, he looked well. His pulse rate was 100 meters. He had a palpable spleen. The combination of fever and rigors in a patient who was recently returned from Africa strongly suggests a diagnosis of malaria. The incubation period is usually 10 to 14 days. In this case, the patient admitted he had not been taking prophylaxis regularly. The diagnosis was confirmed by the presence of parasites in the blood film. Completa el reporte del caso del paciente de la parte A. Caso 45. En la examinación, él se veía mal, su pulso era de 100 por minuto, tenía un vaso palpable. La conveniencia de rigor y fiebre en pacientes que han vuelto recientemente de África sugiere un diagnóstico de malaria. La incubación del periodo. El periodo de incubación es usualmente de día 14 días. En este caso, el paciente fue admitido. El paciente admitido no había tomado profilaxias regularmente. El diagnóstico fue confirmado por la presencia de parásitos en la sangre. Complete the sentence, look at BC opposite to healthy. An infection which can be treated successfully with antibiotics is curable. Another word for that epidemic is an outbreak. Bacteria and viruses are a sample of microorganisms. Someone whose temperature is normal is afebrile. The common infection with Epstein-Barr virus is known as glandular fever. Completa las oraciones. Una infección que puede ser tratada exitosamente con antibióticos es curable. Otra palabra de epidemia sería brote. Bacterias y virus son ejemplos de microorganismos. Alguien que su temperatura es normal, se dice que es afebril. La infección más común, Epstein-Barr, es conocido como fiebre glandular. Complete the table with words from A, B, C, and E opposite. Noun and adjective. Noun, affect, adjective, affected, anxiety, anxious, behavior, behavioral, dementia, demented, disturbance, disturbed, suicide, and suicidal. Completa la tabla con palabras de la parte A, B, C y E opuesta. Los sustantivos y los adjetivos. Afecto, afectivo, ansiedad, ansioso, comportamiento, demente, disturbio y perturbada, suicidio y suicidio. Make word combination using a word from each box. Two words can be used twice. Behavioral syndrome, eating disorder, major depression, mental retardation, personality disorder, psychomotor retardation, sleep disturbance, and substance abuse. Síndrome del... Haz palabras combinando usando las palabras de cada caja. Síndrome del comportamiento, desorden alimenticio, depresión mayor, retardación mental, desorden de la personalidad, retardación psicomotora, disturbio del sueño y abuso de sustancia. Complete the sentence, look at A, B, C opposite to help you. The way a person behaves in his or her behavior. A persistent emotional state is a mood. A sudden attack of anxiety is a panic attack. The form of dementia associated with a gene is called senile dementia. A disorder which is not associated with the pathological changes is functional. An idea which forces a patient to repeat unnecessary actions is a compulsion. Completa las oraciones. La forma en que una persona se comporta es su comportamiento. Una emoción persistente es un estado anímico. Un repentino ataque de ansiedad es un ataque de pánico. La forma de demencia asociada con la edad es llamada demencia senil. Un desorden en el cual que no es asociado con cambios patológicos es funcional. Una idea que forza al paciente a repetir acciones innecesarias es llamada una compulsión. Which symptoms of depression was this patient suffering from? Case 41. A 56-year-old woman presented to her GP complaining of increasing tiredness. Over the past few months, she had lost interest in most things. She has sleeping poorly and tended to wake up early, but denied any suicidal tendencies. She was thirsty and was pacing eating more often. She was eating normally and her weight was steady. Symptoms: tiredness, lack of interest, and insomnia. Complete the table with words from A, B, C opposite, adjective and noun. Blind, blindness, conscious, consciousness, deafness, dizzy, dizziness, numb, numbness, lightheaded, lightheadedness, and unsteady and steadiness. Completa la tabla con palabras de la parte A, B, C, adjetivo y el sustantivo. ciego, ceguera, consciente, conciencia, sordo, sordera, mareado, mareo, entumecimiento, entumecido, aturdido, aturdimiento, inestable, inestabilidad. Make word combination using a word from each box. Double vision, epileptic fit, prodromal symptom, syncopal attack, urinary incontinence, and visual acuity. Haz palabras combinadas usando las palabras de cada caja. Visión doble, ataque epiléptico, síntoma prodromal, un ataque sincopal, incontinencia urinaria y visión borrosa. Agudeza visual. A doctor is trying to determine the cause of loss of consciousness in a 52-year-old man. Complete the doctor's question. Look at AC opposite on the table in 26.1 above to help you. Did you lose consciousness suddenly or gradually? Did you get a warning of the attack? What were you doing before you passed out? Were you worried or under any stress at the time? Did you feel dizzy or lightheaded before the attack? Did you lose control of your bladder? Did your wife notice any involuntary movement while you were in consciousness? You were unconscious. Complete the table with words from A and B opposite, noun and adjective, accents, absent, diminution, diminished, flaccidity, flaccid, expansity, expansive, western, and waste. Completa la tabla con palabras de la parte A y B opuesta, con el sustantivo y el adjetivo. Ausente, ausencia. Disminuido, disminución. Flacidez, flácido. Espástico y espasticidad. Gastado o debilitado. A doctor is giving instruction to patient during the examination of the motor system. Identify what the doctor is assessing in each case. The first one, I'd like you to relax. I'm just going to move your arm up and down, muscle tone. Can I see your hands, musculoskeletal and possibly involuntary movements? Now I'm going to straighten your arm out. Try to stop me. Power. Can you touch my finger with yours and then touch your nose? Good. Now do it again with your eye closed. Coordination. El doctor está dando instrucciones al paciente durante un examen del sistema motor. Identifica qué el doctor quiere decir en cada caso. Me gustaría que te relajaras. Yo solo te voy a mover el brazo de arriba hacia abajo. El tono muscular. ¿Puedo ver tus manos? El músculo si es voluminoso y posiblemente movimientos involuntarios. Ahora voy a enderezar tu brazo. Trata de pararme el poder. Puedes tocar mis dedos con los tuyos y después tocar tu nariz. Bien. Ahora hazlo de nuevo con tus ojos cerrados. Coordinación. Complete the sentence. Look at A, B, C opposite to help you. A flaccid hand grabs limply to form a right ankle with a wrist. Wrist reflexes are reflexes that are stronger than normal. Muscle wasting means the muscle is reduced in bulk. A tick is a foreign and involuntary movement, a key often used to test the Blavinsky response. His coordination was poor. He could not perform rapid alternative movements. A tendon hammer is used to test reflexes. When something is diminishment, it is less than normal. A patient is brought to A&E in coma. When her name is spoken, she opens her eyes, but she does not answer question or obey instruction. What is her GCS score? GCS score 5, eyes opening to speech, 3 points, verbal response, no one, 1, in motor response, no one, 1. 3 plus 1 plus 1 equal 5. Complete the sentences. A baby that is born a week before the expected day delivery is premature. A termination of pregnancy may be necessary for medical reasons. The first 3 months of pregnancy are known as the first trimester. The fetal distress is the first stage of labor, is an indication for cesarean section. It was breech presentation and delivery was by forceps. A miscarriage is another term for a spontaneous abortion. The umbilical cord was wound tightly around the baby's neck and it was unfortunately stillborn. Completa las oraciones. Un bebé que, que es nacido una semana antes del día esperado que iba a llegar es prematuro. La terminación del embarazo puede ser posible, puede ser necesario por razones médicas. Los primeros 3 meses del embarazo son conocidos como el primer trimestre. La angustia fetal es la primera etapa de la labor. Indica la sección de cesárea. La pre- fue una presentación de nalgas y fue traído por forceps. Una pérdida es otro término para un aborto espontáneo. El cordón umbilical estaba apretado alrededor del cuello del bebé y desafortunadamente murió. Complete the table with words on A opposite. Birth and noun. Abort, abortion, deliver, delivery, induce, induction, miscarry, miscarriage, present, presentation, terminate, and termination. Completa la tabla con las palabras de la parte A. Verbo y el sustantivo. Aborto, abortar, abortar, aborción, abortar, aborto, entregar, entrega, inducir, inducción, una pérdida, presentar, presentación, terminar y terminación. Dr. Binet, an ASHO, is presenting a patient at a weekly meeting in the obstetric unit of a hospital. Complete the presentation with the correct form of the birth from 29. This is Clara Davis. She came to the antenatal clinic at the 9 weeks. In her past obstetric history, she has a pregnancy when she was 18. She was terminated and another one a year later with a spontaneous abort. Since then, she was had 3 pregnancies. In the first, the baby was delivered normally at 40 weeks. In the second, she had an induction of labor of 39 weeks because of fetal distress. The third baby presented of a as a breech and was delivered by cesarean section. Make word combinations using a word from each box. Blood stain, breath sounds, pleural roof, productive cough, and vocal vocal. Vocal resonance. Haz palabras combinadas usando las palabras de cada caja. Manchado de sangre, sonidos respiratorios, pleura, frote pleural, una tos productiva y resonancia vocal. Rewrite the equation using words that are better known to patients. Is your cough productive? Did you cough up any phlegm? What color is the sputum? What color is the phlegm? It is ever purulent. It is ever yellow. Have you ever had hemoptysis? Hemoptysis. Have you noticed any blood in it? Do you suffer from dyspnea? Any problem with your breathing? Reescribe las preguntas usando palabras que son mejor conocidas por los pacientes. ¿Es tu tos productiva? ¿Es tu toses alguna flema? ¿Qué color es el esputo? ¿Qué color es la flema? ¿Alguna vez fue purulenta? Es siempre amarilla. ¿Alguna vez has tenido hemoptysis? ¿Has notado alguna sangre en ella? ¿Sufres de disnea? ¿Algún problema con tu respiración? Are the following statements true or false? Give reason for your answer using your medical knowledge. A patient who has a loose cough produce phlegm. True. Crackles are heard when the airways are narrow. False. Suggests the presence of fluid in the lungs. A patient who has a non-productive cough produces sputum. False. Non-productive where there is no sputum. Wheezes are typical of pleural list. False. Indicate narrowing in the airways. A pleural roof is a sign of asthma. False. Pleurisy is called a pleural roof. Complete the description of herpes zoster, shingles, by replacing the medical word in ranges with ordinary English words. The shingles usually start with pain and soreness, then red spots appear that develop into a group of small blisters over a particular area on one side of the body. In most patients, new spots continue to appear for 3 to 5 days. The small blisters fill with pus and then for scabs. In severe cases, there may be scars afterwards. Completa la descripción del herpes, reemplazando las palabras médicas en los paréntesis con palabras ordinarias en inglés. El herpes usualmente empieza con dolor. Entonces, manchas negras aparecen que se desarrollan en grupos de ampollas en áreas particulares en un lado del cuerpo. En muchos pacientes, nuevas manchas continúan apareciendo por 3 a 5 días. Las pequeñas ampollas están llenadas con pus y forman costras. En casos severos, hay cicatriz después de todo. Read the description of the rash of rubeola and complete the notes. The spots are scattered pink macules which appear first behind the ears and one of the forehead. The rash spread rapidly, first of the trunk and then to the limbs. Location and distribution. First behind the ears and one of the forehead, then the trunk and limbs. Group scattered. Scatter, type of lesion, macules, and color pink. Complete the notes for the rash and photograph and suggest a diagnosis. Completa la descripción de la erupción de rubeola y completa las notas. Las manchas esparcidas. Las manchas son máculas rosadas esparcidas que aparecen en el principio de los oídos y en la frente. La localización y la distribución. Primero en las orejas, en la frente y después en el tronco y en los miembros. Grupo, dispersado, tipo de lesión maculas y el color rosado. Localización sería a lo largo del abdomen del mismo grupo. La lesión sería máculas pequeñas con de color rosado. Write the corresponding medical term for the ordinary English course and say what kind of force is involved. Common word, medical term, entire force. Bruise, contusion, and hematoma, blunt. Blunt. Cut, incision, wound, sharp. Graze, abrasion, blunt. Scratch, abrasion, blunt. Stab wound, penetrating wound, sharp, interior, laceration, blunt. Escribe las palabras. Escribe los términos médicos correspondientes al inglés ordinario. Las palabras comunes, término médico y el tipo de fuerza. Moretón, contusión, desafilada. Una cortada, una incisión, afilada. Rozar, abrasión, no afilada. Una herida punzante. Una estocada, penetración y afilada. Una laceración. Choose the correct words to complete the description. of the injuries shown in the illustration. There are races above the left apron and one of the left side of the neck, and a contusion out to the left side to the lower lip and tears to the left cheek. Escoge las palabras correctas para completar la descripción. De las lesiones que aparecen en la ilustración. Arriba de la ceja izquierda hay unos roces, una contusión en el lado izquierdo del labio inferior. Y unas pequeñas y cortadas en el lado, y cortadas en la mejilla izquierda. Write a description of the injuries shown in the illustration. There's a laceration on the left shoulder and an incised wound cut approximately 6 centimeters in left above the left nipple. Describe la descripción de las lesiones mostradas en la ilustración. Hay una laceración en el hombro izquierdo y una herida aproximadamente de 6 centímetros a lo largo del encima de la tetilla izquierda. Complete the sentence. Look at ABC opposite to help you. Frequent changes of position are necessary in the mobility patient to prevent the development of a pressure sore. He has several penetrating wounds in the abdomen for the knee. He was knocked unconscious by a heavy blow to the head. The wounds were only superficial and required no treatment. Look at the conversation. In aid, opposite, and complete the notes about Mr. Young. Usually use medical terms where possible. And frequency and nocturia for 1 year. No dysuria or hesitancy. Strength a little weaker, no incontinence apart from occasional dribbling. Mira la conversación de la parte A y completa las notas acerca del señor Jones. Frecuentemente nocturia por 1 año. No tiene disuria o vacilación, una corriente un poco débil, no incontinencia, algunas veces un goteo. Match the patient description of their symptom with the medical terms. I have to pee every half hour or so frequency. I get a scalding pain when I pass water. Dysuria. I have to get up several times to pass water and nocturia. I have to rush to go to the toilet. Urgency. I have trouble getting a start. hesitancy. I can hold my water. Incontinence and pass some blood in the urine. Hematuria. Combina la descripción de los pacientes con sus síntomas usando tu término médico. Con el término médico. Tengo que orinar cada media hora. Frecuencia. Tengo un dolor que escala cuando orino. Disuria. Tengo que levantarme muchas veces en la noche para orinar. Nocturia. Tengo que correr al baño. Urgencia. Tengo problemas empezando. Vacilación. No puedo sostener mi orina. Sería incontingencia. Y pasé algo de orina. Y pasé algo de sangre en la orina. Hematuria. Describe the findings of the laboratory report in words. There was a trace of blood, gross proteinuria, and no cast. Describe los descubrimientos del laboratorio y reportan en las palabras. Hubo un trazo de sangre con mucha proteinuria y no objetos sólidos. A doctor is talking to a patient during an ophthalmoscopy. Match the underlying expression she used to expression with similar meaning. Right, Mr. Gold, because you have been these headaches, I'm going to take a look of your eyes, particularly the back of your eye, the retina. I'm going to put a couple of drops, a topical mydriatic solution in your eye, which will make it easier for me to see the retina, to aid dilatation. After a few minutes, you may find your vision a bit blurry. This will wear off after about an hour. I need to get rid of as much external light as possible. This means closing the limbs. The examination is done with dimmed lights. Now I'd like you to look straight ahead at that clock, fix off a target. This take a few minutes and your eyes might feel a bit tired, so you can blink if you need it. So don't want to go to look at me, look at the clock. Complete the instructions. Wrap the cuff around the patient's upper arm. Place the diaphragm over the area of the brachial artery. Raise the patient's arm so that the brachial artery is on the same height as the heart. Close the valve of the pump. Pump up the pressure to at least 115 millimeters mercury. Open the valve, elevate it, and slowly deflate the valve while listening and watching the pressure gauge. The first sound you'll hear is the flow of blood through the brachial artery. The valve of the gauge at that point is the systolic blood pressure. The diastolic blood pressure is measured when the sound completely disappears. Complete the test. Phlebotomists is especially trained in taking blood. They are skilled at puncturing the vein to take a blood sample. The wrist, hand, and foot can be used, but more often a vein in the inner part of the elbow is used. It is difficult to locate a suitable vein. The patient may be asked to make a fist, or a tourniquet may be applied on the upper arm to take the vein more apparent. Afterwards, a pressing is applied and the patient is asked to press gently. This helps to stop the bleeding and prevent bruising at the site. It is important that specimen tubes are labeled correctly before they are sent to the hematology laboratory, where a full blood count or other investigation will be carried out.